Choosing to make a change in your health is brave, and the road is often full of bumps and setbacks. In order to find lasting success, it is important to know how to balance challenging your outer body physically while also working on your inner mind. As you embark on your transformative, life-changing journey, I would like you to keep in mind the poem, The Warrior's Journey by Wu Mingdao. Within the Shaolin Temple's hallowed halls, a warrior's spirit seeks its rightful path. In stillness and discipline, I forge my strength, not through aggression, but in inner harmony. From humble beginnings, I rise like the phoenix. Grace and compassion, courage, peace.
There are many weight loss procedures available, each having pros and cons. Bariatric means any stomach procedure that reduces overall calorie intake. Metabolic refers to surgeries that alter hormones that regulate appetite and impact insulin resistance. This video will briefly review the most common weight loss solutions available. However, it is important that you consult with your surgeon to make the best informed choice for you. Gastric balloons are a non-surgical, temporary weight loss treatment option that involves placing an inflatable balloon in the stomach to create a feeling of fullness, leading to reduced food intake and potential weight loss. The procedure does not require general anesthesia. The balloon may cause nausea or a gut ache. They are removed after 6 to 12 months to avoid complications such as migration or stomach obstruction. On average, you may lose up to 10 to 15% of your total body weight. After the balloon is removed, weight regain is typical without adherence to the reduced caloric intake as when the balloon was in. Endoscopic sleeve gastrectomy, or ESG, is a minimally invasive weight loss procedure that reduces the size of the stomach using an endoscopic suturing device, creating a sleeve-like shape. It is less invasive than traditional sleeve gastrectomy. The ESG is performed endoscopically, meaning no incisions are made. This can result in a quicker recovery time, less pain, and a lower risk of complications such as infection. ESG reduces the stomach size by about 70 to 80%, leading to earlier feelings of fullness and reduced food intake. This can result in significant weight loss results. The procedure is reversible, since it does not permanently alter the stomach's anatomy. While ESG can lead to significant weight loss, the weight loss may be less than traditional sleeve gastrectomy or gastric bypass surgery. Some patients may not achieve their desired weight loss goals. Although ESG is considered safe, there are risks of complications such as bleeding, infection, stomach perforation, and narrowing of the stomach. ESG is a relatively new procedure, and long-term data on its effectiveness and safety are still being collected. ESG may not be suitable for patients with certain medical conditions, such as severe reflux disease, large hiatal hernias, or prior stomach surgeries. The gastric lap band, also known as laparoscopic adjustable gastric banding, is a surgical weight loss procedure that involves placing an inflatable silicone band around the upper part of the stomach to create a smaller stomach pouch. One of the significant advantages of the lap band procedure is that it is reversible. If needed, the band can be removed and the stomach will return to its original size and shape. The band can be adjusted by inflating or deflating with saline through the port under the skin. This allows for personalized adjustments to control food intake and weight loss. Regular adjustments or fills of the band are necessary to optimize weight loss and manage potential side effects. This requires visits to the doctor's office for adjustments, which can be inconvenient for some patients. There is a risk of the band slipping out of place or eroding into the stomach tissue, which may require surgical correction. Complications such as band leakage, infection around the port site, or band intolerance can occur. Some patients may experience gastrointestinal symptoms such as nausea, vomiting, acid reflux, difficulty swallowing, especially after eating large meals or certain foods. With the sleeve gastrectomy, a large portion of the stomach is surgically removed, reducing it to about the size of a banana. This results in the subject feeling less hungry, feeling satisfied with smaller portions, and losing significant excess body weight. Sleeve gastrectomy results in substantial weight loss, typically around 60 to 80% of excess weight within the first year, and maintained long term. The surgery removes a portion of the stomach responsible for producing the hunger hormone ghrelin, which reduces appetite. Many patients experience improvement or resolution of obesity-related conditions such as type 2 diabetes, high blood pressure, and sleep apnea. Compared to gastric bypass, dumping syndrome, also known as rapid gastric emptying, causing weakness, nausea, sweating, and diarrhea after eating high sugar foods, is less common with the sleeve gastrectomy. Sleeve gastrectomy permanently removes a portion of the stomach, so it's not reversible. Some patients may experience increased acid reflux symptoms after surgery. Although low, surgical complications such as bleeding, infection, leakage, and narrowing of the sleeve are its risks. While uncommon, some patients may regain weight over time if dietary and lifestyle changes are not maintained. Gastric bypass involves separating a small pouch from the main body of the stomach. A person eats into this reduced stomach size, about 2.5 inches by 2.5 inches, and the intestines reroute digestive juices to mix with the dietary intake later. Gastric bypass can result in substantial weight loss, with an average of 60 to 80% of excess body weight lost in the first year and maintained long-term with good success. The surgery alters gut hormones, reducing hunger and limiting the amount of food eaten. Many patients with type 2 diabetes experience rapid improvement or even remission after gastric bypass, more so than with sleeve gastrectomy. Due to rerouting of the intestines, there is a risk of malabsorption of nutrients, leading to potential deficiencies in vitamins and minerals. Lifelong vitamin supplementation is essential. Gastric bypass is more complex than sleeve gastrectomy, with higher risks of complications, such as ulcers, leaks, and bowel obstruction. The duodenal switch, or DS, combines restrictive elements and malabsorptive elements to achieve significant weight loss. This procedure involves two main components: the creation of a sleeve stomach and the rerouting of the intestines to limit nutrient absorption. Duodenal switch results in the most significant weight loss among bariatric surgeries, with an average of 70 to 80% of excess weight loss maintained in the first year and maintained long-term more so than other procedures. It is particularly effective for improving or resolving type 2 diabetes. The intestines are rerouted, increasing the risk of nutritional deficiencies. Duodenal switch is a more complex surgery with a higher complication rate, such as leaks, infections, nutritional deficiencies. Duodenal switch is not reversible due to the permanent alteration of the digestive tract. Before undergoing any weight loss procedure, individuals should thoroughly discuss the options, benefits, risks, and potential complications with their bariatric surgeon. The choice of procedure depends on various factors, such as BMI, health conditions, lifestyle, and personal preferences. So how do you decide on which bariatric procedure or metabolic operation you want to have? It really just depends on what your goals are. Maybe you're only a little bit overweight and need some help, in which case I would recommend highly considering one of those bariatric procedures such as the lap band, the endoscopic sleeve gastroplasty, or the gastric balloon to help support you on your journey. Perhaps you have metabolic disease like type 2 diabetes, high blood pressure, sleep apnea, and maybe your body mass index is 35, 40, or 50 or greater. The higher your BMI, you may benefit from one of our more aggressive metabolic procedures, such as the SADI or the duodenal switch. My personal experience is largely with sleeve gastrectomy and gastric bypass. I'll tell you a story about a couple. The gentleman in the couple had a sleeve gastrectomy and the wife had a gastric bypass. She had type 2 diabetes and he did not. Within a year after surgery, they were both living a full life together. He was a hunter and she wanted to go hunting with him. They'd wake up at 3, 4 in the morning to get ready to go on their hunting adventures. But the only thing open that early in the morning was a 7-Eleven service station. Him having the sleeve gastrectomy would choose the breakfast burrito. Her having the gastric bypass would try to eat the breakfast burrito, but she would get intensely sick and throw it all up. I think this really highlights the differences in what a person needs to engage in terms of what they're eating in order to make sure that they have a really healthy experience after surgery. Both patients lost a lot of weight and were able to maintain it, even if they ate the random 7-Eleven breakfast burrito. So it's not about being perfect, but it's about really listening to our bodies and acknowledging that processed foods, when they go straight into the intestine, like in our intestinal bypass operations, gastric bypasses, duodenal switches, and the SADE procedures, you don't really have the wiggle room to live a comfortable life eating those foods. So really, have a conversation with your doctor. All of these options are on the table, and we want to make sure that you choose the best option that's meant for you. I also have another disclaimer, and that is the stomach is a muscle. It will stretch over time to accommodate more and more food. And we want it to do this. Because if you were to live your life with the same restriction that you had right after surgery, you would be very malnourished. The stomach does stretch to accommodate the food that we put in it. So you will learn in future videos what that process looks like, increasing the amount of food you eat right after surgery, all the way up to a year out from surgery. Just like my patients, if they were to eat a 7-Eleven breakfast burrito every time they went hunting, first month after surgery, it wouldn't work. They would both be vomiting and choking.